So the next speaker is Patrick Couvreur. Patrick is full professor at the Pharmacie of Pharmacy at Paris Sud, but he is much more. Patrick has been the first speaker in Basel and supported us to start the CLINAM, the first conference, and the fact is that if you would like to fill his CV and you would put all the prizes and titles, we would need 3 pages. You are the original student of SPE.
Right.
So Peter Speisel was the one who received the knowledge about how to do, and the executive was you. And then you went 77, I think, to Paris, and there.
To Louvain first.
Sorry?
To Louvain first.
Ah, yes. And then you made.
And then to Paris.
So the most celebrated sentence, you can say it yourself, was the detection that you can send effectively the particles through the liposomes to bring it to humans.
So, Bea, thank you very much for the invitation. First of all, I am always happy to be here. I will, sorry, it is my previous slides. So, in those 20-25 minutes, I will try to show you 2 examples of advanced nanomedicine which were developed recently in my laboratory. So the first one is the squalenization concept. You know that we have to admit that there are only few nanomedicine really on the market, and only few also if you are looking to the ongoing 3rd phase clinical trials. And in my opinion, this is due to 2 limitations. The first one is a burst release, because as you know, when you are making an encapsulation process, a significant amount of the drug is rather absorbed at the surface of the nanomedicine, and of course, after intravenous injection, you will have an uncontrolled release of the drug before reaching the therapeutic target. The second limitation, which is probably much more important, is drug loading. When you are encapsulating a drug in nanoparticles, PLGA nanoparticles, liposomes, etc., if you are looking to the literature in general, there are only a few percent. And in fact, this is due to the fact that the encapsulation process are done through physical means. This means encapsulation, absorption, entrapment, etc., etc. And so this means also that the nanomedicine concepts can be only applied to drugs which are very, very active at low dose. So the idea to avoid the burst release and to improve the drug loading was to move from the physical encapsulation process paradigm to the chemical encapsulation one. It means to do chemistry instead of physics. And in fact, the idea was to use one molecule of the drug transporter and to chemically link this molecule to one molecule of the drug. And of course, you will immediately increase the drug loading. And if you are a good chemist, of course, you can design a linker which will allow you to release the drug into the target tissue, organ, or even cells or subcellular compartment. The difficulty was to find a transporter which would be able to induce spontaneously the formation of nanoparticles in water. And we choose to use the squalane. Why the squalane? Because the squalane is a natural lipid, biocompatible, that we have everybody in our body. And this lipid has the unique physicochemical property to have a very compact conformation into water. And we took the opportunity of this compact molecular conformation into water to link a lot of drugs to the squalane. And when you are putting the bioconjugate into water, you get, in general, nice nanoparticles of around 100 nanometers. And you can see here that this concept has been applied as you can see here, to small anti-cancer drugs, including doxorubicin, gemcitabine. I will speak about it with drug loading around 40 or 58%, depending, of course, of the drug. This was applied also to antiviral compounds and to antibiotics to kill, to treat intracellular resistant infectious disease, but I have no time to speak about that today. To adenosine with some application in the field of the neuroscience, and even to small interfering RNA. And because you have a chemical link, of course, you avoid the burst release. The first example is the gemcitabine squalane bioconjugate. You can see here the squalane part of the molecule and here the gemcitabine part of the molecule. As you know, it is an anti-cancer compound. And after putting this bioconjugate into water, you can see that you get nice nanoparticles of around 100 nanometers, but as you can see here, with a supramolecular organization. And by X-ray diffraction at small angles scattering, and also by molecular modeling, we observed that we have a supramolecular organization corresponding to inverted hexagonal phases. And you can see here, it is just one example in a preclinical trial. Here it's subcutaneously grafted leukemia in mice. You can see that the squalane gemcitabine nanoformulation was much more efficient than the gemcitabine as a free drug. The second example is doxorubicin, another major anti-cancer compound. You can see that the squalane was linked to the doxorubicin, and after putting the bioconjugate into water, you get nice nanoparticles, but they are not spherical. As you can see here, they are elongated structures. And what is interesting is that after intravenous injection, you can see that here in green, we got long circulating nanoparticles, whereas they were non-pegylated comparatively in red to what happened after the administration of the free drug. And this is due to the elongated structure of those nanoparticles, which are not recognized by the macrophages of the liver. And also the biodistribution was completely modified. First of all, you can see that there was a very strong decrease of the doxorubicin concentration at the level of the cardiac tissue, which is a target for the toxicity of doxorubicin. And also there was a huge increase in the concentration of the doxorubicin at the level of the tumor. And the result of that is an increased anti-cancer activity, as you can see here in the human pancreatic MIA-PACA preclinical cancer model, and also in the murine lung adenocarcinoma. You can see that the doxorubicin, in fact, is the cancer here is resistant to the doxorubicin, because after treatment with doxorubicin in red as a free drug, there was no inhibition of the tumor growth. On the contrary, you can see here in green that after injection of the doxorubicin squalane nanoparticles, you completely inhibit the tumor growth. And what is very important also is the toxicological aspect. So we used a hypertensive rat model, as you can see here, and in red, after injection of the doxorubicin as a free drug during 11 weeks, 1 milligram per kilo body weight, you can see that there was a huge increase into the troponin, and also high toxicity, which was observed also after taking the biopsies of the cardiac tissue. And this toxicity, as you can see here in green, disappeared completely after injection of the doxorubicin as squalenoylated nanoparticles, even at the double of the dose. So you can see there was a reduced toxicity and an increased activity. Another interesting example is that, and again you get nanoparticles, it is the linkage of cisplatin to the squalane, and in that case you can see very clearly that there was a huge increase of the intracellular concentration of platinum, And this was translated by a huge increase into the platination of the DNA. And this was due, of course, as you can see here in confocal microscopy, to an increased penetration of the nanoparticles, which overcome, in fact, the efflux proteins, which are able, as you know, to fight against the treatment with cisplatin. Now, the interesting question was, how can we explain that those squalenoylated drugs were able to improve the pharmacological efficacy by which means of targeting? So, in fact, we started with the hypothesis that, you know, squalane has a chemical structure which is very close to the cholesterol. Because in the mammalian, the squalane is the precursor of the cholesterol biosynthesis. And the hypothesis we had was that, in fact, after intravenous administration of, for instance, gemcitabine squalane nanoparticles, because of the similarity of the structure with the cholesterol, the gemcitabine squalane will concentrate, will be inserted into the cholesterol-rich lipoprotein, especially the LDL. And you know that the cancer cells, because they have a need to get cholesterol to be able to make membranes, to multiplicate, etc., they have an increased number of expression of the LDL receptor. So first what we did was to incubate gemcitabine squalane nanoparticles with human blood, and you can see that we observed a huge concentration of the gemcitabine squalane into the LDL, as you can see here, whereas the concentration of the gemcitabine-free was very, very low, only located, as you can see here, into the water phase. And this very strong affinity of the gemcitabine squalane for the cholesterol-rich lipoproteins were confirmed after intravenous administration in rats. You can follow here the VLDL, the LDL, the HDL, and the free lipoprotein fraction. You can see in blue the distribution of the cholesterol-rich lipoproteins, and after intravenous injection of these gemcitabine squalane nanoparticles, you can see that the profile is following perfectly the profile of the cholesterol-rich lipoproteins. And what was very interesting is that if you are changing of a drug, if you are taking, for instance, squalane adenosine or squalane doxorubicin, you can see that we have exactly the same behavior with, indeed, the same profile for the cholesterol-rich lipoprotein and also the nanoparticles. On the next slide, we investigated more about this interaction, and by transmission electron microscopy, as you can see here, we observed, in fact, that the LDL, after intravenous injection, the LDL will absorb at the surface of the nanoparticles, which are bigger. They will disaggregate the nanoparticles, and the gemcitabine squalane individual molecules will diffuse into the LDL. And this was fully confirmed by molecular modeling, and also, as you can see here, that it was an entropy-driven force which induced the penetration of the gemcitabine squalane and other squalenoylated prodrugs inside of the LDL. And you know that during, I could say, 10 years ago, during years and years, people have tried to use LDL for drug targeting. But you know that the extraction of LDL from the human blood and to make, to encapsulate drugs, etc., was very difficult. You induce a denaturation of the LDL, etc. And so clearly the idea here is to use the natural LDL for making indirect targeting of anti-cancer compounds or other pharmacologically active compounds. Now, I would like to move to another application in the field of the neuroscience and the use of adenosine squalane for the treatment of spinal cord injury and brain ischemia. So you know that adenosine is a very interesting molecule because this molecule has an important role in the energetic metabolism. It is a neurotransmitter and a neuromediator, and normally this molecule should be very efficient to treat some neurological disorders. There are two problems. The first one is that this molecule is very rapidly metabolized after intravenous injections. The half-life of adenosine is only 10 seconds. It's very, very rapid metabolization. And this molecule is more or less hydrophilic, so it doesn't cross through the blood-brain barrier. So the idea, as you can see here, was to couple squalane to the amino group of adenosine. Then this bioconjugate, as you can see here, is forming again spherical nanoparticles with a size of around 100 nanometers, and by X-ray diffraction with a sponge-like structure. And we applied this nanomedicine for the treatment of spinal cord injury by using the T9 weight drop injury, as you can see here. So the animals will be completely paralyzed through the hind limbs, as you can see here. And after treatment in rats with adenosine as a free drug, you can see that you have no improvement of the locomotor score, and the animals remain completely paralyzed. You can see that in yellow, after treatment with the adenosine squalane nanoparticles, after 3 days, there is already a recuperation of the animals, which are able to walk again, and after 18 days, the locomotor scores were completely normal. And this was correlated to a protection, as you can see here, of the small myelinated axons, probably by the adenosine. Then, in collaboration with Turkay Dalkara at Chatenay University in Turkey, we applied the same nanomedicine to the treatment of the experimental stroke. You can see that the model is very classical. You will insert a filament into the carotid artery, and as you can see here, this will induce an infarct tissue, an infarct volume that you can quantify. And you can see that after administration of adenosine as a free drug, you don't reduce the volume of the infarct comparatively to the untreated animals. But after treatment, either pre-ischemia or post-ischemia, or even after permanent occlusion with the adenosine squalane nanoparticles, you can see very clearly that you decreased, very importantly, you can see that here, the infarct volume, and this was correlated, as you can see here, to an improvement of the neurological deficit score. What was very interesting, look here, is that we observed that in the untreated animal there was a lot of clogged capillaries by trapped erythrocytes. And this means that when you are making the reperfusion of the ischemic area, this is not efficient because of those clogged capillaries. And on the contrary, after treatment with the adenosine squalane nanoparticles, you can see that there were less clogged capillaries and there was a sort of neuroprotection of the microvessels at the level of the brain. So the explanation was that, of course, the nanoparticles were able to protect the adenosine from the metabolization, but our opinion was that the linkage of squalane, which is a highly lipophilic compound, will allow to pass through the blood-brain barrier. In fact, this was completely wrong. Because, as you can see here, we performed a double labeling of tritium for the adenosine and carbon-14 for the squalane, and we investigated the biodistribution of those nanoparticles. And you can see that there was absolutely no adenosine, squalane, in blue, able to reach the brain parenchyma, to pass through the blood-brain barrier. Also, only a little bit tritium, but by looking by radio HPLC, we could see that there was no adenosine into the brain. So to make the story short, neither the nanoparticles nor the adenosine squalane, individual bioconjugates, nor the adenosine was able to pass through the blood-brain barrier. So what was the explanation? In fact, we concentrated in the blood compartment, we did a pharmacokinetic, and we observed again long circulating properties for those adenosine squalane nanoparticles, which represented really a sort of reservoir of adenosine into the bloodstream, which was not the case, of course, with the adenosine-free. And then we quantified, as you can see here, the clogged capillaries versus the non-clogged capillaries for the untreated animals and adenosine squalane nanoparticles treated animals. And you can see that very clearly there was an improvement into the microcirculation of the brain. And this shows you a lot of people are trying, of course, to develop nanoparticles able to pass through the blood-brain barrier. But this is a typical example that you can improve the microcirculation reflow after occlusion and have a central pharmacological activity without passing the blood-brain barrier, but playing only on peripheral receptors. Now I would like to finish my talk with the second example, which will be more brief, of using what we call NanoMOF. Those are hybrid nanoparticles of metal oxide frameworks. This was developed in collaboration with Gérard Ferret and Christian Serre in France. In fact, we have developed nanoparticles based on iron oxide clusters that you can see here. And those clusters were complexed, as you can see here, by different diacids. And depending on the length, the molecular weight of the diacids, the flexibility of the diacids, you can control exactly the pores of this NanoMOF material. And this allows to host molecules depending, of course, on the molecular size and shape of the molecule. And we apply that to a lot of drugs very difficult to be encapsulated, especially busulfan, because busulfan, you know, crystallizes very, very easily. And it is impossible to encapsulate busulfan. We tried it either into nanoparticles or into liposomes because of the crystallization process. And because in those NanoMOF, each molecule of busulfan is separated from his night-boring molecules, there is no crystallization, and you are able to load a lot of busulfan molecules by using those NanoMOF nanoparticles. And what is interesting is that because of those iron oxide clusters, you can see that we can do MRI imaging, looking to the biodistribution of those nanoparticles, and this is again an example of nanoteranostic, because in the same nanoparticles you can conjugate, you have in the same nanoparticles a drug which is of course a therapeutic functionality, and also those iron oxide clusters complexed with diacids which allow you to look to have some imaging functionality. So what is interesting, and this is not yet published, is that we observed that NanoMOF had a unique property to be a pH triggered aggregate and disaggregate capability. In fact, you can see that after pH 7, there was a huge increase of the hydrodynamic diameter of those nanoparticles. And as you can see here, this was due to a decrease of the zeta potential close to the neutrality at pH 7. So what happened when you are injecting those nanoparticles intravenously? At pH 7, as you can see here, you have microaggregates, not big aggregates, but microaggregates. And because of those microaggregates, you will have a concentration, a rapid concentration, as you can see here, into the lungs after 30 minutes. And you can see that if you are loading those nanoparticles with gemcitabine, monophosphate in that case, you can see that you will get very high concentration into the lungs during, I would say, in between 5 and 15 minutes. But afterwards, you will have a disaggregation, capability of those nanoparticles because of the solubilization of the diacids. And then you can see that in the lungs, there is a completely disappearance of the iron oxide, as you can see here. And we measured that there was no irreversible inflammatory process into the lungs. So we applied this concept to the treatment, of course, of a preclinical model of lung cancer, of the Lewis lung carcinoma. Those are cancer metastases, in fact. And you can see that after treatment with the gemcitabine loaded into NanoMOFs, you can see that there was, comparatively here to the free drug, a dramatic decrease of the number of metastases. Also, a reduction of metastasis proliferation here from day 21 to day 29, comparatively to the free drug, and of course, a decrease in the lung metastases, as you can see here. So I come to my conclusion. I am on time. I hope that I have convinced you. Those are only two examples, but showing you that nanomedicine can target diseased area. Of course, you can design your nanoparticles with some ligand specific for recognition. It is complicated, but you can see also that there are other strategies, for instance, to use LDL or natural particles to make indirect targeting capability. A very important aspect is also the possibility to overcome the resistance to the treatment. Actually, but it is another story, we have another technology which just finished the third phase clinical trials for the treatment of the hepatocarcinoma, which is also a resistant cancer with MDR, with a strong MDR expression, and the use of nanoparticles allow to overcome the efflux protein. So the drug is the same, but you will deliver the drug in a different way. Also, if you are a good chemist, you can combine various functionality in the same nanoparticles, therapy and imaging, and you can be stimuli responsive, as I showed you with the NanoMOF. And I would like to acknowledge all the people of my group who collaborated more or less to the two examples I have given to you. I would just say that chemistry is very important because you cannot design nanomedicine if you have not a good chemist, like, for instance, Didier Desmael or also Nicolas Julien, who is a specialist in the polymer science, but of course we have also a pharmacologist in the field of the oncology and in the neuroscience, like Simona Murat or Mariana Varna. Thank you very much for your attention.
Patrick, going back to the roots of your life, hartelijk bedankt.
Dank u wel.
Couvreur, I was very much impressed by your data, particularly of the adenosine squalene in spinal cord injury and brain ischemia. How far are you away with this for proof of concept studies in man? Because the molecule itself is not probably, in terms of toxical consideration, is not a very toxic one, and it could be relatively easy to go at least the next step.
Yeah, at the moment, of course, we are willing to enter in phase 1 clinical trials, but you know, it's very difficult in this disease, this type of disease, to collect some funds, because you need first to make the scaling up. And the scaling up means first the scaling up for the chemistry, because I didn't enter into great details, but you have first to make the synthesis of the squalenic acid. It's a long synthesis, and then to couple the squalenic acid with the adenosine, with the amino group of the adenosine. Then you have only the bioconjugate, and then you have to do the nanoparticles by nanoprecipitation, etc., etc. So the scaling up needs, I would say, €1 million. And then we did a lot of toxicological investigations on adenosine squalane, even on the sleep, on the cardiac, because you know that adenosine can have some pharmacological activity in the cardiovascular field. We didn't observe any toxicity, but now we have to do it in 2 animal species, 1 rodent, 1 non-rodent, so there is still a long way before to start with the clinic, unfortunately.
Tore, please keep short all.
Is it? Yeah.
Yeah.
A very short question. Do you know if it's the doxorubicin Squalane conjugate that is active, or if doxorubicin needs to be split from the Squalane?
The doxorubicin has to be split, that's clear. It is the case for most of the drugs, because as long as you have the Squalane moiety, you have nanoparticles, because the bioconjugate is not soluble per se. So you need to have a linkage which is hydrolyzable in vivo to be able to release the drug. This is absolutely mandatory. And I can tell you that we performed also the linkage of Squalane with paclitaxel. And the toxicity was completely disappeared, but the activity also. Just because in that case you have 2 very lipophilic compounds. The nanoparticles is very, very, very lipophilic. The enzymes are unable to diffuse into the particle. You have no cleavage of the chemical bonds. You have no release of the drug. You have no pharmacological activity, unfortunately.
Yeah,
Thank you very much for this fascinating story that's sharing with us. Question for the particles, the lipodensity particles. LDL, HDL, VDL, VLDL are in a very complex exchange, dynamical exchange, mediated by CETP or something like that. How does this affect your kinetics?
In fact, we tested, I didn't show it because I had no time, but we tested the interaction in vivo after intravenous administration to the mice and to the rats. We did it also to the rats. We checked the interaction in a kinetic view after 5 minutes, 15 minutes, half an hour, 2 hours, etc. And we don't see any modification of the profile. This means that always the radiolabeled Squalane bioconjugate is following perfectly the distribution of the cholesterol. And you have observed that with the human blood, we are interacting with LDL. But in the rats, so in the rodents, we are interacting with HDL. Because in the rodents, the HDL is the transporter of the cholesterol.
Thank you very much. One more question?
Yeah, I have another question. Is a suggestion. There is a Wings of Life Foundation that is sponsored by the owner of Red Bull, you know, Formula One and all dangerous sports. He probably has a bad conscience. He's a billionaire, has a bad conscience because many people get spinal injuries with his events. So he has the Wings of Life Foundation, and it's organized out of Salzburg, Austria. And they are funding spinal cord research.
You know, the investors in general are very reserved about spinal cord injury because they told me, you know, there was not a lot, but many drugs or compounds which were working very well on the rats and on the mice. But the translation to the human is very, very difficult in this pharmacological area. But thank you very much for the... Yeah. Thanks a lot. Thanks a lot.
Patrick, thank you very,
thank you very much.
Further discussions, you stay with us tonight?
Yeah.
So there is plenty of time in the evening event to discuss at the dinner.